Hi, Alvin here, and you are watching episode 18 of the 3-Minute Health Tip. In this episode, I'm going to discuss really the difference between focusing on the diagnosis versus the symptom itself, the symptom you are actually suffering with. And more specifically, when it comes to the symptom, the tissue type, the organ that's being affected. If you've been watching the previous episodes, you know that in this new health perspective and the science of G&M, we start to look at our symptoms and our bodies and health differently. We start to understand that whatever symptoms we're experiencing, there's a brain involvement and there's an emotional conflict that initiated the entire biological program. More specifically, we really have to focus on the specific symptoms that we are experiencing and not get caught up in the disease name or the diagnosis. So a good example of this is, a good friend of mine a few years ago that was diagnosed with psoriatic arthritis. And so when we're dealing with psoriatic arthritis, generally it's somebody that's dealing with some skin issues and some joint pain. But we want to be very specific, like how did it present? And he mentioned that, 6 months prior to us meeting up, that he originally started with a skin rash, in his hand, and it was on his body. And then maybe 2-3 months later, he started to develop some joint pain in his wrists and in his ankles. Understanding this new health perspective, understanding G&M and the 5 biological laws, we know that when the symptom shows up, oftentimes it's in the healing phase. So we need to understand what was going on in his life 6 months ago that could have led to the skin rash to begin with. Because we also understand that each symptom is tied to a very particular and specific control center in the brain. And that those specific control centers in the brain, the impact is created there based on that person's subjective and subconscious perception of a very specific, unexpected event. And so a skin rash, for example, is tied to a separation type conflict, whereas joint pain, wrist pain, ankle pain is tied to a performance devaluation conflict. And so when we spoke about this with him, we were able to realize that his separation issues were tied to a work situation that was a bit of a stress and unexpected 6 months prior. And then 2 and 3 months after that initial issue, when he started to develop his wrist and ankle pain, it was related to a performance devaluation regarding personal training and working out and having a sparring session where he actually performed very poorly during that session. You see how it's very important for us to not get caught up in the umbrella term of the diagnosis of, for example, psoriatic arthritis, but instead focusing on each individual symptom that that person is experiencing in order to identify the conflict that started that particular symptom, and in order for them to resolve that issue, have relief, and finally overcome that biological program. Whatever diagnosis you're dealing with, we get this a lot of people with celiac disease or Lyme's disease. We understand the diagnosis that you're given, but we need to know specifically what symptom are you experiencing. Is it a skin condition? Is it a cough? Is it a muscle pain? Because each particular one is tied to a very specific conflict experience and a very specific control center in the brain. I hope that that health tip was valuable and that you are able to get one step closer to being able to identify your conflicts so you can finally get relief. I want to thank you again for your attention, and I'll see you at the next episode.